But it's clear the current situation requires immediate action to stop the Delta variant from spreading further.
Starting Friday, the entire state of Oregon will be required to wear a mask at indoor public places. Today, Governor Brown officially announced the return of the mask mandate after saying she was going to leave it up to local counties. When it was clear they wouldn't step up, Brown says she decided to step in. Once again today, hospitals across the state broke records when it comes to patients hospitalized and those in the ICU due to COVID-19. The governor says the hospital situation is so dire that changes need to happen and fast. She says if something doesn't change in just a few short weeks, hospitals will not have the beds for hundreds of people who will need them. COVID-19 continues to surge in Lane County with the fastest case rate since the start of the pandemic. Lane County Public Health says they're seeing COVID transmission all over the county. Health officials say transmission is happening in child care facilities and a wide range of settings and activities. They're also seeing cases connected to large events like the Lane County Fair and the Oregon Jamboree. Public Health says the Delta variant is spreading quickly.
I think it's safe to say that Delta is quickly becoming the dominant strain of COVID cases in Lane County. And based on what we've seen in other areas, we have no reason to believe that it won't take hold completely and really represent the majority of our overall cases.
We're told the fastest growing age group getting COVID-19 is the 5 to 18 group. However, people between the ages of 20 and 40 are still the people most impacted by the virus at the moment. A new guidance from CDC is firmly recommending for pregnant women to get vaccinated. The change is based on new data about the safety of the vaccines. Health officials say the vaccines are safe, but there are safety concerns for pregnant women who choose not to get vaccinated. They are at increased risk for severe illnesses from COVID-19 and adverse pregnancy outcomes such as preterm birth. The agency also shot down the myth that vaccines can cause fertility issues, saying there is no data to support it. Peace Health workers have a growing concern that they could be fired if they don't get the vaccine. Our newsroom got a memo that was sent to Peace Health employees, and it said that along with other penalties, termination could be a last resort for employees who refuse to get the shot. It says if healthcare workers don't get vaccinated or file an exempt form before August 31st, there could be other actions taken by their supervisor. Failure to comply with those actions, a worker can be removed from clinical duties or face termination. In last week's press conference with Peace Health executives, termination was never mentioned. But officials did say if workers refuse to get the vaccine or file an exempt form, they may be transferred to other duties not involving patients. And we've reached out to Peace Health about this memo, and they declined to give any further comments.